Moving on to healthcare delivery, the Lagos State government has launched 3 additional health plans under the state health insurance scheme called Ilera Eko. The wife of the Lagos State governor, Dr. Ibijoke Sanwo-Olu, says the expansion of the scheme is to accommodate more health issues that affect residents of the state.
Health insurance.
Universal health coverage is designed to reduce the burden of healthcare finances on individuals. This is one area the Lagos State government is paying attention to through the State Health Management Agency. The agency, which is in charge of Ilera Eko Health Scheme, has launched revised and new benefit package for residents at an event attended by various government officials, as well as the wife of the state governor, Dr. Ibijoke Sanwo-Olu. The Commissioner for Health, Professor Akin Abayomi, appeals to residents to take advantage of the new healthcare package.
It is important for us as people of this state to know that when we're healthy, that is the time when you look forward to protect yourself and your family by securing an insurance package for yourself. It is not when you get sick that you should be looking for how to pay for your health bills. We all know that one visit to a doctor, especially if you have to see a specialist or if you have complications and you have to have multiple types of tests, you can be going home with a very large bill. Sometimes that bill can cripple you and your family economically. And if you come from a large group of a large family, you'll suddenly find out that people are contributing their savings just to get you well and back into a good state. But we all know that if you buy insurance, what you could have spent in one day for your health, you can use the same amount of money to cover you and your family for an entire year with a broad spectrum of health facilities.
And the State Health Management Agency says the scheme now has a coverage of 46% and will increase in 2022.
Ilera Eko is what we call the State Social Health Insurance Plan, and this is the one that is for the common man, it is for the masses. We make it as affordable as possible so that everyone, regardless, as I said before, of your socio-economic status, you can have access to care. This just shows an overview of our journey so far in terms of getting people on board. We started, at the end of 2020, we had about 300,000 enrollees, and by the end of 2021, we had grown that number to about 550. Now in January, we've added about 6,000 new people in January. And as you can see from the bottom there, we had a 46% increase in 2021. Our population of enrollees is largely civil servants, which is 51%. The general public is 15%, and the vulnerables are 34%. The service utilization for 2021, we had a total of 2,553 antenatal visits in 2021, a total of 994 deliveries, 518 of which were vaginal deliveries, and 476 were cesarean section. We had 109 surgeries that were carried out under the scheme. Currently, we have a population of about 941 who are diabetics on the scheme, and also 4,225 who are hypertensive patients that are being managed by this scheme.
We now have the Ilera Eko Standard Plus, which is entirely new. So you have more primary care, you have more secondary care. So this is more robust than the standard plan. And so the mental picture that we should be having now is that we're having a product shelf where people will have choices. So it is positioned to take care of the formal sector, general public, especially middle class and above, private groups and social clubs, SMEs. So what is new in addition to the standard plan in the standard plus? Additional premium is required this time around, 15,000 for an individual, because you have more. Higher glasses, lens and frame, medical screening, ever more tests, CT scan, echocardiogram, dialysis is covered, physiotherapy, cancer tests, cervix and breast, higher cancer treatment up to 2 million, feeding subsidy. Ilera Eco Diaspora Plan. This is a bespoke plan. Son, we designed this plan to promote inclusiveness. I am sure everyone is familiar with the discussion over the years with INEC, saying Nigerians in diaspora should have the opportunity to vote. And we also think Nigerians in diaspora should also have the opportunity to pay premiums for their relatives and friends living in the country.
Bill and Melinda Gates Foundation, World Health Organization, and other partners applaud this initiative.
Now, Lagos State holds a very special place in our hearts. It's the only state we engage in the South. And we've had an excellent partnership with the state dating back to 2010. And we are particularly delighted that our support through the strategic purchasing for family planning, maternal, newborn, and child health project implemented by a consortium of partners and ably led by the Health System Consult Limited, HSCL, who did a great job working with LASHMA, HEFAMA, and the State Ministry of Health and other partners contributed to the actuarial studies and other work that led to the review of the benefits package to now include a full bouquet of services, including family planning, of course. And this is no small feat because Lagos State has blazed the trail as the first state to incorporate the full complement of family planning services into the health benefits package. And we hope that other states and their national health insurance scheme will learn from this and do the same.
This package will guarantee access to affordable health care, which is a sure way to achieving the universal coverage. And so as WHO, our job is mainly to provide technical support. And we're very willing to work with the state government in the rollout of this impressive package.
We are aware of what family planning, does in the life of a woman. We have one of the highest maternal mortality rates all over the world. And we know that family planning can reduce this maternal mortality rate by as much as 30 to 40%. So including this in the basic package really is very exciting to UNFPA.
Mrs. Sonwolu, who is also a medical doctor, says over 700 million naira has been disbursed for universal healthcare coverage.
In the face of new economic realities and an evaluation of the health needs, you will all agree with me that these improvements are indications of our concern for the people of Lagos and commitment to the fact that Lagosians deserve the best of everything, including health packages. The administration has continued to support the operations of Ilera Eco by subsidizing the premium of public participating in the scheme through paying 75% of the total premium, and we have disbursed 750 million equity fund to pay insurance premiums for the vulnerable residents of the state. We are looking to make the equity fund a first-line charge, which will improve the health of the vulnerable in the state, as we also improve their lives through social protection interventions. We are working to improve the quality of services provided in public facilities by embanking on public-private partnerships, PPP, for the management and maintenance of various primary health care facilities, PHCs, across the state.
Residents have been advised to key into the Ilera Eco healthcare plan and avoid excessive spending on medical services.